What would it be like to be an emergency and critical care physician? Now, certainly this job comes with a lot of stress and pressure. Media depictions kind of show this and do a pretty good job, I would say. But of course, there's a lot more to that work. And that's what I wanted to get into, and that's what I did by way of this fantastic guest that I have lined up for you today. His name is Dr. Blair Bigham, and he is an emergency and critical care physician based out of Toronto, Canada. He's also a journalist. He's written a book on the topic, which I might add is a bestseller, and you should go check out. And we have this fantastic conversation covering a lot of his work and what it truly entails. And that's what I want to share with you today. But before we get into it, I do want to remind you, if you do like this conversation, go check out the full-length audio version. And you can do so wherever you access your podcast. Just do that search for Life as a ... All right, well, I think it's about time to get into things. So why don't we? So on Life as a, I do have this segment called Coloring Wikipedia, in which I read off a definition related to the guest background. In Dr. Bingham's case, I went with intensive care medicine. So this first clip represents him responding to that definition. And what we find here are some of the really interesting sort of insights that he has relating to his work and some of the roles, responsibilities, and nuanced looks at what it all means. So check it out.
I think I simplify my job by saying that I use technology to keep dying people alive in hopes that their bodies can regain function and we can shed the machines and they can get back to doing whatever it is that they love doing most. Intensive care is really about using technology to push people through their disease so that they can go and recover somewhere where they don't need technology just to be alive.
Yeah.
And one thing I love in this definition is that it talks about end of life care. I think a lot of people maybe exclude that from the definition of intensive care medicine, where they think it's all about machines and keep going, keep going, keep them alive, keep them alive. But a very large part of intensive care is recognizing when you've been beat, when your machines aren't having their intended consequences, and when somebody's organs have failed to the point of not being able to recover. And at those junctures, we do bring in a palliative philosophy or an end of life philosophy, and switch modes from resuscitate with all of our machines and devices and drugs to palliate, where we focus on comfort and dignity, and remove the tubes and wires and lines that tether people to a hospital bed.
Okay, well, next up, I have a clip of Dr. Bigham explaining a day in the life, or maybe even a week in the life of an emergency and critical care physician. And I like it for a lot of different reasons, but one, I think it helps us move past some of our own visions or ideas of what this profession's all about. We're kind of getting into the nitty-gritty, and you're getting a really good look at the reality of the work. So check it out.
Where I work when I'm on service, I'm on service. I work from a Monday to a Sunday, usually with a colleague. We split the unit in two. And so I'll show up sometime around 7 o'clock in the morning. I'll round on my patients, meet with their families, provide any procedures that need to be provided. Some people need various drains placed or various lines placed. And then I'll liaise with other specialists, surgeons, infectious disease experts, pathologists, whoever it is that I'm relying on to make the best decisions. And then between me and my colleague, one of us has to be in house 24/7. So we usually share the night. So every other night I stay in house and provide care overnight. Usually there's a new admission or two, people coming in through the emergency department or being flown in for a surgical service or something like that, who then need intensive care. So the ICU week itself is busy. It's probably 120 hours of work and it's pretty exhausting. And
Yeah.
so the day after my week of service is sort of a day off. The day after that is usually a full day of what we call catch up. When you're on service, you can't do much else. And so you got to get caught up on your life, whether that's laundry or emails or
Right.
grocery shopping. And then I've got a couple of days left in the week that is usually consumed by my education and scholarship work around advocacy. So it
Okay.
keeps us busy for sure.
Yeah.
We tend to work every other week and in the ICU. And that
Mhm.
leaves every other week to do your academic stuff.
Okay. Wow. Yeah, it sounds like a lot. As I said
Yeah.
earlier, like I
It's
suppose you find a
it's
rhythm to it
busy.
all, but initially, I mean,
You do. There's something actually quite peaceful about just knowing that all you're going to do for a week is take care of patients. You don't need to answer your emails. No one expects you to because you're on service. You don't have to go to meetings because you're on service. If there's
okay.
something actually, it sounds strange to say it's predictable. I don't know what clinical work I'll be doing, but just
Yeah.
knowing that I'll be doing clinical work in an
Almost
ICU
a purity to it in a
there's
sense,
something
right?
very soothing about it, actually. Just
Yeah.
knowing, what are you doing this week? I'm just taking care of people.
Yeah.
I'm just in
Yeah.
the ICU, right? I'm hanging out with nurses and respiratory therapists and
Yeah.
dietitians, and we're just going to do what we can to get people better.
Okay, well, moving along, I did have this question for Dr. Bigham in terms of, what it truly takes to succeed within this line of work. What type of person does this work appeal to? And certainly not everyone would be able to handle, again, some of the stresses, pressures, and everything associated with this work. So here's a clip of Dr. Bigham breaking down that for us. Procedurally, the world that you're in would seem to be utterly different than any other form of medical care outside what we were just speaking of, and ostensibly it would also kind of require you to be maybe wired a little bit differently, psychologically speaking. I don't know. I don't know. Again, from somebody who's on the outside here, what would you say to that? I mean, like the stress, the pressure, like you said already, some of these quick decisions that need to be made, what would you say to this?
Yeah, I think over my life, I've been exposed to escalating degrees of stress and responsibility. And so I've sort of proven that that's something that suits me. I
Mm,
thrive on it. I'm a bit of an adrenaline junkie. When people are critically sick, I like the fact that I only have a few minutes to figure out what's wrong. I like that the blood work hasn't come back yet, and then I just kind of have to guess, right?
yeah.
Like, there's
Is that,
something
sorry to interrupt.
very,
Sorry
yeah.
to interrupt. Is that something that you would say you could grow into, like if through experience, or is that something that you kind of just have to be hardwired once you're entering
Yeah,
into that
I
work?
think becoming a doctor is such a long process that people have the opportunity to select specialties that suit their disposition. And so
Mm,
people who don't like working in a gray zone, who don't like uncertainty, or who don't like having to make really quick decisions are probably going to select something other than emergency
yeah,
medicine or critical care. And so really medicine offers something for everybody based on what you're interested in and just what your own personality can tolerate or can value or can add
yeah.
to. I would make a terrible endocrinologist. Like I don't have 3 months to wait for anybody's blood sugar to improve. Like I'd get so bored. Oh my goodness. But it's important work. It's valued
Yeah,
work. But for me, I like that instant gratification of having to really work in a gray zone where you don't have a lot of data, but you have to make a pretty quick and profound decision to move forward with the treatment plan before somebody dies.
so in the spirit of this program, Life as a, we like to dive down a little bit deeper, get into the nooks and crannies of the work of these guests to provide you with insights that you might not get anywhere else. And I think this next clip represents that. I was asking about some of the hidden intricacies or hidden looks at the profession. So here's a clip of Dr. Bigham breaking one particular aspect down of the work that he's involved in.
The inability to know if someone's getting better or not is really hard. The human body can take weeks to recover, sometimes months. And so sometimes, when you're on service for a week, that patient who you start with on a Monday, by Friday or Saturday, they might not look all that different. You're kind of like, geez, like, have I done anything for this person? Like, have I contributed to their
Mm,
recovery at all? Um, and sometimes it's really hard to be patient and just know that you're supporting that person's body while the body
yeah,
heals. That can be frustrating. And sometimes confidence shattering when you're like, oh, like you feel like an imposter. You're like, I don't know, maybe I have this all wrong. Like maybe I'm missing something. And sometimes we'll panic and I'll come into work one day and be like, oh my, it's day 6. This person's no better. Maybe I'll order a new battery of tests. I'll order a CAT scan of their whole body. I'll be like, okay, maybe I'm off here, and I'll chase a
yeah.
whole bunch of new ideas. And often all that comes back negative, and I'm left back with where I started. And, 3 or 4 or 5 more days later, the person starts to turn around. But that can be difficult just to have the confidence to stay the course.
Yeah, yeah. And also knowing yourself too. I mean, you've kind of alluded to that already. Like you seem to be like somebody who wants to get onto things and move forward as quickly as possible. But
Well,
sometimes
if
time is just that
yeah,
something you just have to work with, right? Yeah.
if you have the right diagnosis on admission, you're
Yeah.
probably going to do well, right? Like we'll get you out of the ICU. And it's the people who maybe don't have the right diagnosis, who have a complication or who have this sort of unexpected course where, they end up having more and more reasons to be in hospital.
Okay, well, I am going to squeeze in one more clip here, and this one's centering on the notion of how this work truly affects and impacts a professional working within this space. Certainly, when you're encountering issues of life and death day in, day out, it's going to rub off. There's going to be some sort of impact on a person within that field. So here's a clip of Dr. Bingham explaining that for us.
Certain professions give professionals different opportunities to kind of existentially, ponder life and living issues. And, at the top
Mm,
of the list, or absolute top of the list, probably would be yours, as a critical care physician. I'd be curious to know about how often those types of thoughts enter your mind. And obviously, with the patient, you're considering, saving
yeah,
this person, but even like bigger picture sort of looks at
yeah.
yourself maybe
Uh,
and everything else.
Smaller picture wise, I mean, it's easy that the people who end up in the ICU almost never planned to be there.
Yeah.
And normally you can trace the reason for their illness all the way back to some political failing, a policy or lack of policy in our society, a disadvantage that somebody had that led to a particular disease. I can think that that's true for people who get shot or stabbed, people who get certain
Mhm.
types of cancers, people who have certain types of accidental trauma, people who have lung disease, heart disease, metabolic
Mm.
disease. Almost every disease can be traced back to some sort of social determinant of that disease.
Yeah.
And so then you just feel like the ultimate band-aid applier, right? Like I'm just trying to keep this person duct taped together. And I know that many of my patients will go out the door of the hospital, their life saved by the work done in the ICU, um, and are at very high risk for continuing to decline and bouncing back. And we'll see them again in the ICU. And so that just makes you a lot more sympathetic to people's circumstances and a lot more aware of the importance that we all play in our society of making sure no one's left behind.
Mm.
On a macro level, I mean, I see people die every time I go to work. I see people struggle with what it means to have a good death. I see people struggle with fighting to survive. I see families either come together or fall apart over those circumstances. And so that makes you think a lot about your own personal life, your own family,
Yeah.
your own commitments, your own friends, and how you uh, contribute not only to society at large, but also to the community that surrounds you and loves you. And that can be a blessing. It can also cause you to lose a little bit of sleep. But what it does is it always strives you to live your very best life.
I think it is about time to be drawing this video to a close, but as always, I do encourage you to check out the full-length audio version. There's just so much more in terms of insight and just depth to the conversation that you'll be able to uncover. For example, we get into the role of technology and of course, how it's helping and assisting in so many ways, but also on the other hand, it is also kind of creating these moral and ethical and even financial quandaries for those within the medical field and within this space in particular. Beyond that, we also chat about some of his experiences while working during the pandemic and a lot more. So again, check out the full-length audio version. You can do so wherever you access your podcast. Just do that search for Life as a ... And as always too, I would really, really love that like or subscribe. So please, please, please hit those buttons if you've got a second. And then finally, please tune in to the next episode of Life as a. It'll be coming at you right next week, so don't miss it. All right, until then, we'll see ya.